What do your CF genetic testing results really mean? When you receive your cystic fibrosis genetic testing results, it can feel overwhelming. Understanding what these results mean is crucial for your health and family planning. Genetic testing for cystic fibrosis focuses on the CFTR gene, which is responsible for the condition. This gene can have various mutations that lead to cystic fibrosis. However, interpreting these results requires careful thought about your clinical context, family history, and other diagnostic tests. If your test is positive, it typically means that one or two mutations known to cause cystic fibrosis have been found. But a positive result does not automatically confirm a diagnosis. Clinical symptoms, such as chronic lung infections or digestive issues, along with additional tests like sweat chloride tests, are necessary to confirm cystic fibrosis. On the flip side, a negative or inconclusive test does not completely rule out the disease, especially if you have symptoms that suggest cystic fibrosis. The mutations tested are usually those proven to cause cystic fibrosis, often using standardized panels recommended by experts. These panels focus on the most common mutations, but they may not catch all rare mutations. If your family has known mutations, testing can specifically target those, providing more clarity. If the test finds one mutation, you are typically considered a carrier. This means you do not have cystic fibrosis but can pass the mutation to your children. Carrier screening is recommended for anyone planning a pregnancy or who is currently pregnant to assess reproductive risks. Diagnosing cystic fibrosis involves more than just genetic results. It requires a combination of clinical symptoms, sweat chloride testing, and genetic findings. Genetic results alone cannot definitively diagnose or exclude cystic fibrosis. Sometimes, genetic testing reveals variants of uncertain significance. These are genetic changes whose impact on cystic fibrosis is unclear. They requiring expert interpretation and may need further functional testing to understand their significance. Some individuals may have mutations linked to milder forms of cystic fibrosis or related disorders. These cases need specialized clinical evaluation to determine the best course of action. Genetic testing can also play a role in prenatal and reproductive health. If both parents are carriers of pathogenic mutations, prenatal diagnostic testing can determine if the fetus is affected. This can be done through procedures like amniocentesis or chorionic villus sampling. It is important to note that negative results or results showing only one mutation may lead to further testing. This could include full CFTR gene sequencing or tests for deletions or duplications if there is still a clinical suspicion of cystic fibrosis. Genetic counseling is vital to help you understand the implications of your results for your health and family planning. In summary, cystic fibrosis genetic testing results provide valuable information about disease-causing mutations. However, they must be interpreted alongside clinical evaluations and other diagnostic tests. They help inform diagnosis, carrier status, and reproductive risk but do not determine disease severity or prognosis on their own. Seeking professional genetic counseling and clinical follow-up is essential to fully understand what your specific cystic fibrosis genetic test results mean for you and your family.